はい、日本の皆様、相変わらず野中腰痛クリニック院長の野中康之です。また石田副院長と今日はドクターパウザにも来ていただいています。皆さん。今日はアメリカのテキサス州に来ているんですね。で、なぜアメリカのテキサスにまで来たのかというと、我々のクリニックでは腰痛を中心とした治療をしてきたんですけれども、今アメリカの方では頸椎に対する治療の適用も拡大されつつあり、患者さんの数がものすごく増えている。で、実際我々もですね、腰、バックペインですね、だけじゃなくて、首の治療を希望される方も非常に多いので、今回ですね、アメリカにパウザー先生のもとにですね、頸椎治療のライセンスを取りに、やってきました。今日はですね、今日の動画ではですね、2部、構成で考えております。何をお話ししたいか、何をお伝えしたいのかっていうと、まず多くの患者さんに頸椎治療に対する、適用であったり、メリットであったり、そしてですね、その有効性も含めて、どのようなものかっていうのをパウザー先生が今日来られるので、話をこの後お伺いしたいと思います。もう2つ目はですね、最近のアメリカで行われている新しい治療、再生カテゴリーに関する治療に関しても、パウザー先生が非常にお詳しいので、だってトップを走っておられますからね、先生に聞いていきたいと思いますので、よろしくお願いします。でまず前半で、今日はケビン・パウザー先生に来ていただいています。頸椎治療、頸椎のディスクシール治療、について、お伺いしたいと思います。その前に一つだけ、パウザー先生はディスクシール治療に関しては、当然開発者であられますし、そのオーナー、今ディスクシールテクノロジーっていう会社のオーナー、されてるんですけれども、非常にですね、権威のある方でですね、非常にお忙しいのでお時間いただくのも大変だったんですけども、非常に、貴重な機会ですので、皆様もそれをですね、提供できることをも幸せに思ってますし、時間いただいて、本当パウザー先生、ありがとうございます。Thank you. Today. Nice.
ありがとう。
じゃあ、早速質問です。頸椎のディスクシール治療に関する適用範囲を教えていただけないでしょうか。
Patients who have neck pain, and it goes into the arm sometimes, shoulder, and even headaches. The neck causes head pain. And so these are patients that previously were limited to only having neck surgery or physical therapy, and that does not help. And so it's patients with disc herniations, disc bulges, people with severe neck pain have done very well with the Discseel procedure.
非常に範囲も、頭痛まで広がヘデークまで来ているので、非常に範囲も広いと思いますね。
One thing that many physicians don't even remember is the fact that many headaches are caused by the neck. They start in the neck and it causes severe pain behind the eyeballs. People feel like pounding in eyeballs, much pain, and that all comes from the neck. And when we treat the neck, the head pain, the headaches get better.
首の頸椎症に関して、頭痛までですね、効くっていうのは非常に範囲が広くて私も驚きです。で、次はですね、腰の治療は最低でも3ヶ月、6ヶ月、また1年と非常に長い期間やっぱりかかる場合もあります。効果が出るまで。では、首の頸椎のディスクシール治療に関しては、どれぐらいの期間を見ておけばよろしいでしょうか。
We've learned that when we treat the neck, the people get relief much sooner than the low back. And there's many reasons. It's possibly because the disc is smaller in the neck, so it heals very fast. We have many patients who they feel better within the next day. We don't expect that, but many patients tell us that their head pain, their headaches are gone, their neck pain is gone, and even patients with shoulder pain or arm pain experience relief relatively fast. But we prefer to underpromise, so we tell patients, give it time, expect relief to happen slowly during the first 1 to 2 weeks. But people are able to return to activities and work within 1 week after having their neck treated.
非常に早いような印象がありますね。腰痛に比べたら頸椎の方が、効果が若干早めに出ると考えてもいいんですね。
when we treat the discs in the neck, the strength of the discs returns to normal that day because of the fibrin. Fibrin causes the disc strength to be normal, so people can feel good knowing that there's nothing they can do that'll cause that fibrin to leave the disc, but the real value happens over the following days and weeks, and that's when fibrin causes new disc tissue to heal. And this is the only thing that causes disc tissue to heal. Stem cells alone cannot do that. PRP cannot do that because they leak from discs. The fibrin becomes a part of the disc. It makes the disc strength normal immediately, and then the disc heals slowly over the following weeks and months.
特に PRP よりも、ディスクシール治療の方が優位であるっていうのはコンセンサスになりつつと思うんですが、それは間違いないでしょうか？
I believe that all of the spine specialists in the world now agree that PRP can cause infection in the disc because the PRP acts as if it's a breeding ground for bacteria, if you will. But the fibrin is different, and so fibrin can treat the disc, and fibrin itself is an antimicrobial. The fibrin itself is like an antibiotic, and that perhaps is why patients that are treated in the neck with the Discseel procedure do not experience infections. And so we don't allow anyone to use PRP in the discs or stem cells in the disc, but also those things leak. Stem cells leak from the disc. It's a leaky disc. And long ago, we were taught that it's a pinched nerve, but today we've learned it's not the pinching of the nerve, but instead it's the chemical leaking on the nerve that causes the symptoms. And Discseel immediately seals the disc, but more importantly, causes the regrowth of new disc into the future.
ありがとうございます。我々も年間1000人の患者さんを治療してて、同じようには感じています。では、頸椎の改善率はどうでしょうか？
So, the vast majority of the patients experience relief. Out of the thousands of discs that we've treated in the neck, nobody has been made worse. No patient has had to have surgery. And that by itself is a very valuable thing for patients. And the majority of the patients experience relief. It's safe to say that over 80% experience relief, but the new data shows that when we add exosomes to the fibrin, then the relief is greater than 80% of the people benefiting long term. And we're now following patients for over 5 years in the study, and they're maintaining that relief.
非常にいいと思いますね。期待ができますね。ではですね、次は、一般的な頸椎の手術、いわゆるオペレーションとの違いを教えていただけないでしょうか。
The cervical procedure that you and I are doing is very simple and relatively fast for the patients in the operating room. The procedure time is less than 15 minutes, and then they go to recovery for 30 minutes. And within 30 minutes, they may go home and they can feel good knowing that the strength of their discs is normal. So even if they were to fall the next day or be in an accident, they could feel good knowing that their disc strength is normal. Unlike spine surgery, when they do fusions with rods and plates and screws, that takes up to a half of a year. But more importantly, those surgeries cause problems later on. The Discseel procedure does not cause problems in the future because it's natural regrowth of our discs.
治療を実際に受けられた患者さんは、どれぐらいの経過で、リハビリをしていくのか、本当にどれぐらいのリハビリが必要なのか、またそれが必要ないのか、教えていただけないでしょうか。
The reality is, after a patient has the cervical Discseel procedure, the doctors have done everything that's necessary for those patients to be better. But because those patients have had neck pain for so many months or years, they need to go back to activity slowly. And that's not because of the disc is now fixed, but instead it's because those patients have not been at their full potential for many, many years. So they can exercise slowly and turn back to activities. But the disc is fixed and it's safe and ready to go immediately.
Thank you. ほとんどリハビリも さほど必要な、復帰をしていくということだと思います。ディスクシール治療の実績を教えていただけないでしょうか。
We have many physicians around the world who are performing the Discseel procedure, but for the cervical Discseel procedure, we intentionally limit it to only the very best doctors, Dr. Nonaka and Dr. Ashida. They are the best doctors, and so therefore they're in a small group of doctors around the world that treat the cervical spine. And with all of the doctors that treat the cervical spine, we follow their outcomes, and the outcomes are very good. We've limited the training to specific neurosurgeons and other doctors, and they treat the cervical spine, and there has been no complications throughout the world with any of the specialists treating the cervical spine. And we're very honored that Dr. Nonaka and Dr. Ashida are part of that small select group of doctors who are experts on treating the disc and experts on treating the cervical spine, the lumbar spine, and the thoracic spine. There's very few doctors in the world that have the skills that allow the spine to be treated without major surgery.
Exciting. Thank you. Thank you. では、この後ですね、石田先生から、新たな質問を、今行われている質問を、新たにアメリカで行われている治療の、次のステップの治療なども、石田先生の質問を、していただきたいと思います。よろしくお願いします。